Hi, everyone, this is Dr. Syed Haider, and I'm really pleased to be here with Dr. Steve Bierman. And I should have asked you how to pronounce your last name. Is that how you pronounce your last name?
Yes.
Okay, great. And I'm going to ask you to fill out the intro because I haven't prepared it properly, but I do remember that you're an ER trained physician, and you have the way that I came across your work was through your first book, Healing Beyond Pills and Potions, and it really made a big impression on me. I actually um, mentioned it and talked a little bit about it, gave some examples taken directly from your book at the FLCCC conference in Dallas in April.
Right.
Um, and I thought that, wow, I mean, they should be teaching this in med school. It should be like a course every year. You should be, sharpening your skills in how to communicate with people. And we'll talk about that. I really want to, get people a little bit of an intro to that book in your own words. And also, you have started, I think, a couple of medical device companies, and you have something like 200 or more patents. So I'd love to hear a little bit about that too. And I know that you are probably at this point a master NLP practitioner and also a medical hypnotist, and you had your own practice. Perhaps you still do that, and maybe people can seek you out for your help. So was there anything I missed that you'd like to mention just about your background, where you come from, your training, your expertise?
I think that's very good. You covered a lot. The only thing missed is I started as a family practitioner. I had board certification in family medicine, and then did 20 years of emergency medicine, and after that had my device career. The entire time though, from what was it, 1979, probably around 1985 on, I've had a private practice in medical hypnosis, or what I prefer now to call noetic medicine, mind medicine. And that's still ongoing. I'm still seeing patients every day.
Amazing. That's wonderful. So to start with, I wanted to, and these are all things that you've described in your book. So I wanted you to maybe give people an idea of some of the formative experiences. You mentioned a number of them in your book, like I think you did firewalking at one point, and you saw a qigong master healing people, and you went to South America and sought out somebody to fix your shoulder. Um, so I maybe if you could like bring us through those series of experiences, and then your exposure to NLP, and how you got into all of this, how it all started for you.
Right. Well, as I said, I had a fairly traditional training. I'm third generation allopathic MD. And I had a fairly traditional training at UCLA and Northwestern University, and then here, University of California in family medicine. And, as you know, when you finish medical school, in a sense, you're sort of told, well, there you have it. You have the encyclopedic realm of everything knowable about human health and illness. Go out there and do some good. And for a moment, for a brief moment, you feel as if, well, I've really mastered this knowledge base. And then, you quickly discover that, in fact, it's a much bigger world. The mystery is bigger than the knowledge base, and your competencies are limited. And as I learned in family practice, you have somewhere on the order of 95% of your patients coming in with essentially psychogenic uh, illnesses or concerns or distress of one form or another. So that was that I felt, I have to say honestly, I felt incompetent at the end of 3 years family practice residency, dealing with the real life situations of actual patients. I could, just like most graduates, I could take a 8-minute history, zero in on a physical problem and give a physical partial remedy for that physical problem. But I knew, I sensed there was something more to it.
I
And
just want
then,
to
yeah,
interrupt you, sorry, for just a moment. So just to clarify for people, when you say 95% psychogenic concerns in a family practice, setting, are you saying that 95% of their physical complaints can be boiled down to like psychosomatic stuff, or that there's a lot of kind of like psychological stuff that contributes to a small amount of physical problems? Because most people, when they think of medicine, they'll be like, okay, I came in with a busted knee or high blood pressure or diabetes or, a stroke or whatever, these chronic illnesses in a family practice situation. So what do you mean by 95% of the concerns that you would be seeing would be psychogenic?
Yeah, well, I'll say what I mean and distinguish that from what the uh, so-called science is. There are numerous papers out there that discuss 95, 90% psychogenic illness, and they base it on various, psycho inventories, testing, and things of that nature. What I would say from my current experience and from 40 plus years of doing noetic medicine is that in traditional medicine, we have what I call a single source hypothesis. You have pneumonia, that's because of this bacteria. You have a heart attack, that's because of those plaques or that plaque rupture. You have, say COVID, that's because of this viral infection. And we aim at treating that single source, which in allopathic medicine is always physical, right? It's always that. Everyone should understand that there are no great studies anywhere demonstrating the rightness, the truth of the single source hypothesis, but it's what's fed to us time and time again. Now, every now and then, an allopath will nod, a traditional MD will nod to something more by saying, "Oh, you have stress, you got to go get your stress relief things." But what I say is no, it's actually much more than that. The single source hypothesis is untrue, and it's demonstrably untrue. And in fact, when people get ill, they get ill because there is a multiplicity of factors, physical and often psychological, uh, unconscious and conscious, contributing to their illness. And so the way I operate is to discover what are the contributory noetic or mental causes of illnesses, as well as the physical causes, and then try to address as many. You can't, often you can't get all, but you can certainly address as many as possible. And you don't have to, this is my experience now, you don't have to knock down every single cause, because the body's sort of intrinsic writing mechanism is trending that way. What you really need to do is knock off as many causes as you can, whether they're physical or mental, and then inspire with your ideas, with your noetics, and that's what my book talks about, inspire their intrinsic healing capabilities to take over from that point on, and the ship will right itself.
I see. So I had kind of interrupted your trajectory here with that question, but I wanted to go back and just can you give us a brief like overview of some of those formative experiences that helped you realize that there was more to illness than just that single source hypothesis, and that
Right.
maybe there's more to health and wellness or just, human existence than we currently understand?
Well, I'll tell you the key to it for me, Syed, and I think it's something that everyone can do, whether you're a doctor or not. Um, a little history. I was reading a beautiful essay. I don't know if you've happened on it, but it's absolutely stunning. It's in this book by Robertson Davies. I'll try to show it to you, called The Merry Heart. And in it is an essay entitled, "Can a Doctor Be a Humanist?" And it's funny and brilliant and learned. As I was reading it, I was say, I don't know, 6, 8 years into my career. As I was reading it, I hatched this idea. I think there's a question that if I ask it right, technique will matter, but if I ask this question right, it may give me some information, the likes of which I don't get from a traditional history and physical exam. And I was so excited that I remembered talking a buddy of mine into giving up his shift so I could go in the ER and then
Wow.
start trying this thing out on patients. That's the beauty of, you know, emergency medicine is where I worked is it was one doctor and nobody's really looking too close at you unless you make a mistake. And so you have the ability to try things out. So think about this, my first patient, pick up a chart, the guy has left testicular pain. I go in there and I do the exam, get the labs, and he has what's called epididymitis. It's a little inflammation on a small organ on top of the testicle. So I treat him and give him a referral, and that's where allopathic medicine ends, right there. And of course, the referral doc, it's his job then to find out what's the actual cause of this inflammatory reaction. Is it an infection? Is it autoimmunity? Is it something else? But that's not where I stopped because I had this burning question in my head and I knew I had to ask it right. So here's how I asked it. As if I were about to leave the room and then casually turn it around. So I'm presenting it as an, oh, by the way, as if it's not that important. So that lowers everyone's resistance, right? I go, by the way, just kind of curious. You're not going to know the answer to this, and I'm not going to know the answer to this. But, you could have had this 2 weeks ago, or say 2 weeks from now. And like I say, you're not going to know, but if you had to guess, why now? Just guess. Why today? And remember, this is my first case, so I'm not convinced at this point that this isn't just a stupid question with no answer, right? And he turns around and he says to me what everyone says. This is for the caregivers out there. What everyone says first and answer that question. They always say, well, I don't know, you're the doctor, you tell me. And so this is an NLP pacing maneuver. I say, well, that's right, you don't know, and I am the doctor, but like I said, I don't know either. So just guess, why today? And then as I've learned at that point, the most important thing you can do as a caregiver is shut up. Just let it percolate to the top. Give it time. And the time may be instantaneous, or it may take as long as a minute or so. And the answer generally comes as a question, but the answer is there. And here's what this guy said. He turned around, buckling up, and looked me in the eye, and he says, hey, doc, do you think this could have anything to do with the vasectomy my wife wants me to get tomorrow? Contributory noetic cause. I do the same thing to a heart attack patient. You're the doctor, I know, but just guess. Well, I don't know. Do you think it could have anything to do with the fact that my mother-in-law moved in yesterday and she's staying for a year? Contributory noetic cause. A guy with a cluster of ulcers, never had them before, above his first molar. Why today? Just guess. Just guess. I don't know. Do you think it has anything to do with the molar extraction they have planned for tomorrow? And on and on and on. So if you do this as I have for 4 decades, you're asking this question of virtually every patient you see. What you discover is that almost not everyone, right? Somebody is walking down the road and a flower pot falls on their head. There may be no contributing noetic cause. But almost everyone has an answer that's plausible, at least as contributory. And those answers begin to chunk out in broad categories: dangerous identifications, unhealthy wishes. Oh, I wish I could get out of this job no matter what. I wish I could get out of this relationship no matter what. Very dangerous. Never allow yourself a no matter what wish. That's a no-no. And other categories like curses from physicians, you'll just have to learn to live with it. It's chronic. You have 6 months to live, that kind of thing. You hear these broad categories of answers to why today, and it becomes inescapable. It's inescapable that our science is incomplete. This reductionist material science that would have you and me reduced to cells and molecules and ignores these emergent human properties that we live and breathe with, our dreams, our hopes, our frustrations, our wishes, our early learnings and conditioned experiences. All of these things, of course, contribute to illness.
So I think that the skeptical mind would hear this and think that, we like to create meaning, right? We like to find some sort of meaning that we'll cast around until we figure out something that might, connect to the thing that you're presenting with. But I think the answer there is probably that you've gone a step further, and then you've been able to help people reverse illness, actually, based on this idea that those, as you call them, noetic causes, were contributing to the illness. So if that were the case, then if you can address the noetic cause, the illness should disappear. So I remember this example from your book about the surgeon who had his hands covered with warts. Can you tell me about that? That was a good one.
That's interesting. I will tell you that story. Not a pleasant man. His wife actually called me. He was in dire circumstance and needed help. His wife, who was a charming lady, called me and asked if I would help. And there's a multi-century literature on what's called hypnotic healing of words, and almost any technique can work depending on the authority structure, hypnotic influence of the doctor / patient relationship. In this case, this was with a surgeon who was very grandiose. He had horrible warts all over both of his hands. He was triple gloving, and the hospital was considering expelling him from the operating room. So he came in, puffy and resentful, and who do you think you are? And my wife sent me here, and this is bullshit, and I can't do this. And I saw him a total of four times. And in the course of it, of course, I asked questions like, we're not going to know this, you and I, but if you had to guess, these could have gone away a year ago or a day or two from now. They're still here. Why today? Why now? And like I said, we don't know, just guess. And the noetic causes that came forth from that query were basically, I'm fed up with my job and I want to retire on disability. And he had something like a $20,000 a month policy to retire on. So there was incentive, let's say. But he also, as I explored it further, he also wanted to play golf, required the use of hands, and he had a deep sense of personal pride, and he didn't want, on a cognitive level, to bow out of his surgical career because of some physical weakness. So he was conflicted. And I work with him in my practice 4 times, addressing, you can see he has what I call baleful wishes. I want to get out of this job no matter what. They're in conflict, of course, with other cognitive things, but they exist at a level where they can cause and were causing problems. And as those were addressed, in this case, trance was useful. I don't always use trance or need it, and neither do most doctors. But in this case, it was useful because he was so puffy and resistant and hell-bent on defying. But he also really, really wanted a more healthy outcome than what his unconscious say had chosen. And so in In 4 visits, his warts disappeared. Now, people doing hypnotherapy will listen to that and go, well, yeah, I mean, so what? I disappear warts every day. And it's true. I mean, the power of an idea is tremendous. We should, as doctors, we should note that a wart is a viral caused tumor. Of course, it's a benign tumor, but it's in the class of from the class of viruses that we now know cause throat and cervical cancer as well. So think of it with an idea properly communicated. With an idea, you can disappear viral caused tumors. And that's a little key right there. And in my view, people should be, reaching for that key and opening that portal.
So do you find that there's some illnesses that are more or less amenable to noetic medicine?
You know what I find is I'll give you like you're in Puerto Rico, it's sunny. I'm in California, it's sunny. But let's go for a winter metaphor. Um, I find that it's easy to stop a snowball and hard to stop an avalanche. And what I mean by that is if I have a patient who's in the early phase of almost anything, I find that I'm much more successful than if there's so much momentum gathered behind the illness, plus all the curses of the doctors they've seen, the side effects of the medications they're taking, and so forth. It becomes harder, but not impossible. And I record some of these in my book. My next book will have many, many more. I've been, I think, blessed and fortunate in my own practice to see even people who are fairly far down the slope reverse out of horrible illnesses, whether it's stage 4 cancers, for example, stage 4 lung cancer, uh, and breast and ovarian cancers, these horrible diseases. I have had good fortune in seeing not all, but significant proportion of my patients, if not improved, then reverse entirely out of that. Also, the other ailments that you see commonly, chronic fatigue, fibromyalgia, autoimmunities of various sorts, and so forth, as well as sort of deeply fixed psychological disorders, eating disorders, uh, profound depressions, and everything in between. Uh, it's easier when they're early, but
So yeah, so doctors, they'll, sorry, I think I cut you off, but
no, it's
can you
okay.
keep going? I didn't hear what you were saying.
No, I was just saying it's easier to get these things when they're early, of course. Um, but I'm generally willing to take it on, even if it's fairly advanced.
So I guess myself, like I kind of have this sense that people who have chronic fatigue syndrome, psychological disorders, even autoimmune disease, these might be easier to address with this method. But you're saying that can't even cancer actually would fall into that category for me. But you're saying even things like say like diabetes, or seizures, or like there's really no category of chronic illness that you think can't be improved or even resolved theoretically by this approach.
Well, let me kind of back into that. So I would say from the advent of the early Haider experiments in what became known as psychoneuroimmunology, to the current state of knowledge, one thing that we've seen is that, and this is sort of a muddled metaphysics, is that ideas or psychological manipulations of one kind or another uh, can have effects through nervous connections to virtually every organ and tissue in the body. And I think that's fairly well established, and that the evidence is impressive on that. With that as a sort of backdrop, I would say that when you sit with a patient and you ask why today, and you look through the history for other common causes, especially dangerous identifications, usually with a parent, curses, baleful wishes, retained childhood misconceptions. When you go after these common causes, if you find them, and this is random, but 9 out of 10 times you will find them. Go after those causes and address them therapeutically, and then, yes, you will see a change. Now, you may just ameliorate the situation. You may block the pernicious effects of a doctor curse, but you may also reverse people out. And so I have not yet seen clearly where not to go with what I'm calling noetic medicine, mind medicine.
So there's this chapter of your book where you describe, I guess, kind of the philosophy. I don't know what the right word is for it, but in there you mentioned that the subconscious kind of, this is what I remember from it, kind of like takes stuff. So you have a wish, for example, like a baleful wish, as you put it, to get out of a certain situation, no matter what. And so your subconscious kind of surveys the territory. What do I have to work with here? What kind of genetic disorders, what kind of nutrient deficiencies, what kind of chronic, suppressed viral infections do I have here? And I could create, this short list of illnesses for this guy to, get him out of this situation he doesn't want to be in. And so it takes that into account, and then it comes up with whatever it, finds might be the perfect kind of quote unquote solution for your problem that you presented to it. So I guess, did I put that correctly, or did I leave anything out? And also, does that mean that people can address those problems by removing, any of the, I guess, physical causes for them, so that your subconscious can't create that illness anymore? Is that one way that people get better? Like if there was some antiviral you could take, or some nutrient you could replace, or, some diet you could change, or lifestyle measures that you could take. I mean, is that part of why people get better? Do you think that you can address physical causes without addressing the mental root of the issue that manifested it?
Well, this is, let me give you my thoughts on it, but I'm going to say the evidence base for this requires further development. And that's something I'm engaged with now with Andrew Weil and the University of Arizona College of Medicine. But what I see in my own practice happening is that, yes, traditional allopathic medicine will interrupt the physical causal chain that's the result of these multiple causes contributing and deciding on, we're going with that illness, right? And if you can interrupt that chain, let's say we're going for an infection, we're going to let the strep in our throat run wild. It's been there forever, but we're going to let it run wild. Yeah, go ahead and give the penicillin and put that down. But what you're left with is you're still left with these noetic mental causes pressing for satisfaction. So I got to get out of this job no matter what. That's a very common one. Or person doesn't realize it, but their mother was a hypochondriac, and now they're the age she was when that was all going on, and they're going through sequential undiagnosable illnesses, which have these sort of vague bucket diagnoses attached to them. like my favorite is seronegative. I'm sure you delight in this one. Seronegative rheumatoid arthritis, right? I can't tell you how many of those people have come into the office and they might be on high dose steroids and methotrexate, and it's an adjustment up always of their vitamin D level while addressing the noetic, contributory noetic causes, such as I've mentioned, results in a total resolution of their symptoms forever. I mean, people are always hesitant, but I'm not. A cure. I have people who came in, they couldn't even put their coats on from their arthritic joints, and they're out, doing 30, 50-mile bicycle rides 4 days a week now. So yeah, the answer to your question is yes. The physical interruptions that we do with medicine, say blocking a causal sequence, or the physical improvements that we do by virtue of exercise, supplements, and so forth ourselves, that might preclude some disease expression. I would urge all of us, though, to still address the underlying noetic causes, because it's by doing that, what you achieve is a better state of health.
Do you look at this through a spiritual lens that, health, disease, for example, disease, I guess, is like a spiritual growth opportunity for people, or, it's something along those lines?
Well, I have to say, Syed, I have a hard time wording spiritual sensations. I believe everyone carries their spiritual existence into the office, and that you merge on that dimension with your patients. It's very hard for me to word those things in any way that sounds, learned or scientific. But I think that those are elements of the doctor-patient interaction that are sadly broadly ignored, I would say, and that I do believe feature into health and healing. Whether you grow spiritually out of your experience depends a lot on the person and how they want to reflect on what they went through. But I would say this, and it might be a little different than what you're expecting. What I call psychospiritual growth requires that certain milestones be met and passed through. And many of the noetic causes that I discover in patients impede, not only cause illness, but impede their psychospiritual growth. For example, she may not know it, but this female is so deeply identified with her mother that she's married her father type. She's engaging in health and illness the way her mother did, and she's destined, as one on the outside can see, to a terrible outcome like her mother's terrible outcome toward the end of life. When you address, say in this instance, this dangerous identification, help the person cut the cord, cross into the threshold of adult life, which is choice, not programmatic behavior, but actual choice. What you've actually done there is you've lifted them over to the next phase of their psychospiritual growth. And I do see that in my patients, and it manifests as you might expect, as joy, gratitude, creativity, expansiveness, all these things. Probably not where you were going that, but that's kind of how I engage with that.
No, I think that's perfect. So I guess I get a lot of so one of the things that patients get really annoyed about when they go to doctors is when the physician can't figure out what's wrong with them, right? Kind of in the same category as the seronegative rheumatoid arthritis, but it doesn't even, they just can't figure out what it is, and they say, go see the psychiatrist. It's all in your head, it's psychosomatic. So what would you say to people like that, right? I guess we've already kind of answered the question, but would you describe this as the same thing as psychosomatic, or do you distinguish the two?
Well, it's interesting. When I was a young doc, psychosomatic medicine, there were journals, and that was a common term in use, and it's fallen into disuse now.
Mhm.
Uh, my experience as I'm sharing with you is that much more commonly than not, patients presenting with any kind of malady have contributory noetic causes. They also often have contributory physical causes. Um, and so to me, I think that is the base. I don't think there's anything exceptional about that. That's how humans function. So to me, you can call it all psychosomatic if you want. I don't know what advantage comes with that. To me, it's the hunt for causes and cures. When you run a history on someone, we're not taught, you and haven't been taught how to ask the questions that get at guilt, that get at baleful wishes, that discover a dangerous identification, that unearth the curses they've heard from multiple authority figures, uh, or that shine light on a retained childhood misconception that's causing their illness. We don't know how to do that. But once that's taught, once we learn it, that's what I'm working on now. That becomes part of the basic history. And I think we begin to see patients not as we've been taught to see them. This is the key. Not as we've been taught to see them, which is aggregates of cells and atoms and molecules only, but we begin to see them once again as the humans that we recognize them as before we went into medical training. If
So
I
at
can,
this, go ahead.
yeah, if I can I just want to because I know you're in this realm too. I want to just kind of diverge for a second and say that if we're all frustrated, we know that traditional allopathic medicine today is incomplete. And even if you're doing integrative medicine, which you are and I am, where you're combining whatever other sort of physical modalities work, if you're leaving out the noetics, it's incomplete. But why do we leave that out? Why are we allowing CEOs to tell us we can see a patient in 12 minutes and get to the root of the matter? Why have we gone so awry? And I think it all comes down to material reductionist science. The petri dish is not the person, and yet we're behaving as if it is. And so we're losing our humanity, they're losing theirs, and the insurance industry is, taking it to the bank. We need to slow down and listen to each other.
So I had mentioned earlier how some of those formative experiences that you wrote about in your book. I just wanted to revisit them real quick just to see that if since you've written the book, have you come to any deeper understanding of what's going on with shamans and with Qigong, energy healing and stuff like that? Do you think it's a different form of what you're doing, or do you think there's something else there that they're doing that we don't know about?
That's a great question. And I feel that I do have an understanding of it. Let me say this at the top, and then I'll explain what I believe is going on. Each modality, whether it's an allopath or a homeopath or Amazonian shaman or whatever, may have what they do may have intrinsic salutary effects, right? And I grant that broadly across the board. And we have ways, our science allows us ways of discovering that if we do proper placebo-controlled studies with a natural history arm in the study. We can determine that, okay? But here's what I know. Once you understand what placebo really is, which most placebo researchers from Stanford to Boston don't, but once you understand what placebo really is, and you reverence that, you respect it for what it is, then your understanding of the healing arts is magnified globally. And here's what it is, in my view. When you were a little boy, Syed, I don't know this, but let's say, of course, at 2 years old or 1.5 years old, you were as helpless and dependent as most kids that age, incapable of forethought, abstract thinking, and surviving in a world by yourself. And so it was a biologic necessity that you bond with or identify with someone, and you did, right? And what happens in the nature of that bonding, this identification, is that his or her reality becomes yours. And I mean, the information transfer from one person to the other in this tight identification is much more than we expect and much more than traditional psychologists think. And if you doubt that, you can go to my YouTube station and watch the most amazing experiment in human psychology and think about it and its implications. But suffice to say that the authority figure or the parent figure in that setting has tremendous capacity to implant or imprint information in us, not just at a conscious level, but at deeply unconscious levels. What makes us think that the next time we feel helpless and dependent, that we don't find ourselves triggered in that exact same receptive state? In fact, we do. And we've all experienced that at times of grievous trouble, 9/11, the first moments, think back, everyone's confused, and we're looking for the one least uncertain. That's what humans do. You scan for the one least uncertain. When a patient gets a dire diagnosis, they're helpless and dependent. And that scanning for the one least uncertain, that comes on again. And what that person says, and this is why I'm so keen on language, what that person says goes deep to the heart and soul of that helpless and dependent patient. Here's what is said explicitly or implicitly in the jungles of Ecuador, in the hallowed halls of medical science and all the healing arts. It's always the same suggestion. And I call it the generic placebo suggestion, but it's always the same, expressed or implied. If you undergo this intervention, if you do X, provided X is credible in the cultural context you're in, if you do X, then Y, the prescribed outcomes, positive or negative, placebo or nocebo, will occur. And what drives that idea to actualization is the hypnotic influence of that authority figure at that time of helplessness and dependency on the part of the patient. So if you just hold that idea and you think, I'm going into this shamanic retreat, I'm totally disoriented, I don't know how to get out of this jungle, I don't know who these people are, I have this terrible ailment that I don't know how to fix, I'm totally helpless and dependent. And the implied suggestion is, if you go through this ritual, he's going to suck the black arrow tsensak out of your neck and puke it into the jungle mud. Then you will get well. He has hypnotic influence. Just like the psychoanalyst, if you sit on this couch for 4 years and we come to agreement on your past, then you get well. Or the chiropractor, if you lay down and let me crack your back, then you will get well. Or the allopath, if you take these various pills and unguents, then you will get well. Or the surgeon, if you undergo this surgical procedure, then you will get well. That's going on universally. And as Wayne Jonas points out, and we should all be aware of this, somewhere between 60 and 80% of the effect we get from proven medicines is owing to their placebo effect, right? The incremental above placebo, above that 80 or 60, is what you've proven in your randomized control trials. So the generic placebo suggestion, driven by the hypnotic influence of the one least uncertain, the doctor, the professional, is what drives people more than anything else, even in today's world, to healing. And we should recognize that and not be afraid of it. I just read a study in a placebo book that just came out, Oxford University Press. I just read an author saying, if you can believe this, in certain studies, the placebo has a 96.3% efficacy. And he went on to say, imagine how troubling that is for researchers in the big pharma companies. Well, it may be troublesome for them, but dude, you just found the perfect placebo. What is that? And you got 96.3%. You don't need a drug. Do what you're doing.
So it's interesting, I've read a little bit of the placebo research, and they tend to identify certain conditions that seem to be particularly affected by placebos. So Parkinson's, until I started reading about placebos, I was kind of shocked to see Parkinson's in there. But Parkinson's was one of them, where you can oftentimes switch out the person's medication and they continue to have the same effect. And there are a few other, I'm not an expert on placebos, but I guess, I have a few questions I want to ask you. So what do you think's going on there? And then after that, I want to get back to this least uncertain idea. But just before that, I mean, why do you think the placebo researchers find that there are, a few, certain sets of illnesses that seem to be particularly affected by placebos?
Well, let me sort of challenge the premise a little bit. So if you go back, there's debate amongst guys who care about these things of when was the first, placebo control. There's some homeopathic stuff in 1906, and there's a study referenced by Beecher in 1938 for the common cold, where there was a true randomized placebo-controlled trial conducted. But at any rate, somewhere in the 20th century, it became a formalized procedure. If you look at the range of studies and the efficacy of placebo across the broad range of studies, and mind you, this is thousands and thousands, tens of thousands of clinical trials. What in fact you see, forget those researchers for a second. What you see is that regardless of what's being studied, it can be kidney stone. There's a study that shows a 61% diminution in kidney stones from placebo, right? And we think of stones, a stone is the ultimate emblem of physicality, right? And yet placebo had a 61, 62% efficacy in that trial. And likewise with diabetes and heart disease and hypertension and on, all these things. So placebo is universally effective in varying measures. And so you ask, well, what's going on? Well, we have clearly an intrinsic healing capacity. And if you understand that placebo is the actualization, placebo effect is the actualization of that generic placebo suggestion. If you undergo this procedure or intervention, then you will the prescribed outcomes. If you understand that, then what you understand is once that suggestion is properly implanted, it activates the available intrinsic healing capacities that we all possess. We all possess them. And those intrinsic capacities, you can call it the healer within or the doctor within, or go to Paracelsus and call it the destroyer and the savior, whatever you call it. It's kindled by the proper use of ideas and their massive impact on health and healing.
So it seems, most physicians should be making use of the placebo effect, and yet I think most physicians are really bad at triggering the placebo effect. Oftentimes, they'll actually trigger a nocebo effect, or they won't appear to be very certain. So I wanted to ask you why you call it the one who's least uncertain versus the one who's most certain. And should people, who are healers and are seeing patients, should they try to appear certain if they're not certain in order to help them to trigger a placebo effect in somebody else if they do feel that's possible?
Yeah, again, Syed, those are really wonderful questions. So let me take the first one. So uh, least uncertain versus certain. I won't go into broad detail on this, but that's humans don't assess certainty when they're doing quick, rapid fire judgments. What they look for is signs of doubt or uncertainty. It's sort of like, I think of this as iris recognition when we're trying to find out, oh, how are they most the same? The programs couldn't get it. But as soon as we went to least difference, boom, you have iris recognition. If you're if you're in business like I was, and you're presenting to financiers, they don't have a way to know how much you know. They just
Hmm.
want to see where your doubt lies and
Hmm.
where you shudder. And that's what humans do. If you're, especially when you're down and out, if you're helpless and dependent, what you scan for is the one least uncertain. But to your next question, uncertain about what is the answer. So it's fine to say to a patient, I don't know the answer to that. And as you know, um, I counsel that we should begin with humility and never leave it, and be comfortable saying, I don't know. Um, but the next sentence should be something like, but what I do know, or what I intend to find out, or what I will search for you is the following. And what you're conveying is a different kind of certainty. The certainty that they discover in you is a certainty that you care and you're dedicated to achieving whatever their endpoint is. If it's a cure or diminished pain or whatever. If you're the one least uncertain about, I will engage with you, I will use everything I have to help you achieve your goal, and I am your ally through this thing to the bitter or the beautiful end. They detect that, and it's that certainty. Just like, you have a young mother and a baby. Well, okay, there are other mothers who are more certain about the care of that baby, right? A mother of 10, she's certainly more certain, but there's no one in the world more certain that she will lay down her life for that kid no matter what. And that's
Hmm.
the certainty they're looking for in their caregivers.
I see. That's an interesting answer. So do you have any recommendations for patients? Because once I read your book, I started every time I heard a caregiver or a physician talking, I was like, you know what? You probably shouldn't have said it that way. Or somebody's telling me about something their doctor said, and I'm like, oh man. Um, I mean, who knows? It's like no one knows how to talk. And there's so many doctors and patients have so many physicians and healers that they go to. How do you avoid, fielding all these curses? I mean, what do you say to people like in your family? I mean, what do you tell them?
Well, here, I'll give you a good example. Again, I have to say, Syed, um, these are the important questions, and I really applaud how connected you are to the reality of caregiving. These are so important. Um, I had a patient come into my office. This is a quick anecdote. Who friend sent her in. She was an 80-year-old lady, complaining of years and years of dizziness. She literally lived on the floor. If you went to visit her at her house, she'd be lying on the floor having a conversation because she's too dizzy to get up. And they said, well, won't you do hypnosis? And she'd been worked up everywhere, a couple times Mayo Clinic, three or four of the experts here, every image study you can imagine, blah, blah. And there was no diagnosis. And so I thought, okay, she's well worked up. I'll get my history. I won't do the physical part of it. And I'll have a few hypnosis sessions with her, trance sessions. So I had three, and she didn't respond the way my patients normally do. At that point, I always back off, as I'm sure you would, and say, all right, I'm not going to believe anything that went before. I'm going to do my own history and physical. And the consequence was she had normal pressure hydrocephalus. And what that means for this discussion is I'm about to send this beautiful, charming, wonderful, delicate woman, she's a magnificent lady, to a neurosurgeon. I'm sending her for a shunt, but he's a neurosurgeon. And so you and I both know, while there are brilliant exceptions to this, and I applaud those people, by and large, if you're sending someone out to a neurosurgeon, she is going to get cursed. She is going to get cursed because, as you say, they've been so busy learning what they're learning, they haven't learned how to talk or that it even matters. And I can excuse them for that, but I have to also acknowledge this is going to happen. And if I don't prepare my patient, she could be hurt. And I'll tell you, I'll jump forward for a half sec. Boy, did he ever curse her. He looked her in the eye and said, and this can never be true. This is the fallacy of prophecy, but it's also the fallacy of extrapolating data that had no application to her whatsoever. He looked her in the eye and said, you have only a 33% chance of getting a good result from this. And gasp, right? But I had prepared her for that. And so here's how I did that. I tell them, first of all, I talk a little, as I do in my book, about the fallacy of prophecy. There is nothing in the medical education of you or me or anyone we know that enables them to look at an individual and say, you will have this or you will have that. There's no prophetic potential in sample information from clinical trials. Zero. So you can't do that. And as I'm teaching this to my patients, and I go into some detail, it has to do with the group. You may or may not, match up with the group. Chances are you don't. I also remind them that if they were to ask that doctor, and I invite them to do it, what will your state of health be day after tomorrow? Please tell me. What the doctor's going to say is, well, I don't know. I don't know how. I don't know. I hope I'll be well. Well, if you don't know your own state of health and you're living in your body, where do you get off predicting mine? So the first thing I do is undermine the authority of his prophecy or her prophecy. I think that's important, but I do it in a respectful way that just addresses the reality of our science. It cannot predict. The next thing I do, and I use my authority to empower it, is I say, you'll feel it if they misspeak. And chances are, even though they're kind and very highly skilled, they will misspeak. When you feel the assault of what I call a curse, use your mantra. And your mantra is this: you don't know me. You don't know me. You don't know me. And you say that internally. You don't have to, most people are bashful or respectful or non-confronting. You don't have to confront the person. but you have to have that shield, it's like a Wonder Woman type shield. And you have to bounce off these curses and say, how could you possibly say a thing like that? And so I try to prepare them for that by undermining both the authority and by giving them a protective mantra to use in the event of a curse.
Great. Yeah, that's fantastic. Thank you. So I want to, we've already been talking, I think, for an hour here. It just went by so fast, but I want to shift over to the pandemic and just get your what you think happened. So, a lot of research has been done and a lot of things have been said. And so some people look at the all-cause mortality data and they say, well, I don't see a pandemic. There was no pandemic, right? All-cause mortality didn't go up until we started intervening. Maybe there were some spikes, due to our interventions early on and later on. But do you think that, for example, like this is one, perhaps theory, things like quote unquote long COVID is very, very similar to chronic fatigue syndrome. Maybe it has some slight differences, but essentially it seems to be the same thing, or even vaccine injury oftentimes looks the same. Um, do you think that the rate of this is kind of constant within our society, but maybe in the last few years, last 3 years during the pandemic, people became more aware of it? Or do you think it was kind of like a hysteria that was created by, 24/7, fear, being trumpeted from every direction at you for 2 years straight? Just what do you think about what happened and all the people who now feel as though they've been, terribly vaccine injured or have developed long COVID and they can't climb out? Some people have quite severe forms of it and you hear a lot about it, right? Whereas in some studies they'll say, well, the incidence is about the same as it was for long flu, which I had never even heard of until this pandemic. I didn't even know it was a thing. But when I thought about it, I realized, what? I guess that's one way of saying, like a persistent cough going on for 4 to 6 or even 8 or even more weeks in some people, some persistent effects of a flu. And we know, people come into the clinic and you work it up and you're like, you know what, don't worry about it. It's just a post-infectious cough. You'll be fine. So I guess it's kind of like a long, convoluted question, but I guess I just want to hear your thoughts on what's happened to people and how they can recover. But first of all, what do you think is actually going on?
Well, there's a lot going on, obviously, right?
Yeah.
There's a virus out there. The virus has an infection with that virus can and often does have adverse effects on, especially on people with 3.8 or more intercurrent uh, uh, illnesses or conditions. Um, there's also tremendous uh, commercial interests at play. Bias and influence are not absent in any study that's been done in the COVID realm at all. Nobody can convince me of that. The vaccine studies, I'm just going to run a quick list for you, Syed. The vaccine studies, I think your listeners should know that when, say, Sanjay Gupta pronounced, and I heard it live, pronounced that the vaccine was safe for kids, he was privy to data that later published in the Journal of American Medical Association, which I'm sure he saw, where the children, this is a unique vaccine technology, never before given to children for this specific illness especially. The kids in that randomized controlled study were followed on average 2.3 months, 2.3 months. And then all the placebo kids were vaccinated, so there could be no further follow-up. I would further say that in all, and I've looked at them all, and you have to go very deep into the studies to understand that in all of the ivermectin treatment studies, New England Journal and Journal of American Medical Association, even though we know that Tamiflu needs to be administered within 48 hours, I'm giving you a rough average over 3 studies, that on average, the ivermectin was not administered until after the 5th day of symptoms. And then it was proclaimed equivalent, no advantage over placebo. So I'm suspicious of the studies. And then if I go to the actual patients, which is what I obviously care most about, and you do too, the question I have is, okay, we know what the physical exposure is. All right, it's to this coronavirus. We also know that there may be host defense compromises, whether those are vitamin D levels, which are highly important, or zinc levels, or other aspects of host defenses, cellular, receptor, and so forth. Those things play, but we shouldn't allow ourselves to think this is somehow different, and there aren't also perhaps contributory noetic causes. And so in my experience, which is I think more limited in terms of numbers than yours, but the patients I have, for example, with long COVID, when I do my history and explore for contributory noetic causes, so far in my experience, I find it every time, which gives me something to work on. Nobody's to blame for that. This is all unconscious. But it gives me a handle to work on. And when you work on a baleful wish, let's say, that might be contributing, or when you work on a curse that they heard from some, oh, you're just going to have to live with this, from some authority figure. When you work on those and dispel those, then I see people getting better. Let me say one other thing that I think your listeners, many of your listeners did this, and this was very, very common during the tail end of the so-called pandemic. And I'm sure you've seen patients who did this. It was a long, long time to be anxious and fearful about one's own death. And like you said, the news media were hammering this hysteria, hammering it, and it was exhausting to people. And so toward the end, many people uttered within themselves, and you might be surprised how many did this, but it was not hundreds or thousands. I believe it's millions of people around the world did this. Toward the end, they said, they got to the point where they're like, I can't take this anymore. I just don't want to deal with this anxiety. I wish I could just get this damn disease and get it over with, live or die, I'll take what comes. That is a baleful wish. Because what you could have done, folks, is you could have said, I would like a subclinical infection. Remember, in the very beginning of the, quote, pandemic, they told us 42% are asymptomatic. They told us that. That's probably the single most important statistic of the whole pandemic, but it got buried. But they could have said, I'm so sick of this. What I really want to do is have a subclinical infection. I'll test for antibodies later. They didn't. They said they didn't know to do that. And you can do that from now on, folks. You can always wish for, just give me subclinical. I'll take the antibodies, no symptoms. And I do that when there's stuff around. That's my, internal communication. But a lot of people did that, and that baleful wish was their contributing noetic cause. That was the last straw. And then they ended up getting COVID, and as you know, most of them survived and came out of it. That's sort of a random thoughts on COVID.
Oh, that's great. So in your book, you have some great advice for physicians and healers on how to kind of divert the nocebo effect that might happen when you're doing like a full, you're giving people the risks and benefits and, telling them all the possible side effects. And you can kind of divert that. And I'd love to talk about that. But, reading that, the thought that came to my mind was, well, that's great that we can minimize the harm or perhaps completely deflect it. But do you think that, like, if we roll the clock back, 200 years, even 100 years probably, there was an era where there was a much more paternalistic approach to medicine. Do you sometimes feel as though that might be actually more beneficial to go back to something like that? Or do you think that the way that we practice medicine nowadays is the way that we should practice medicine, and it's not really that we're losing anything by hiding things from patients as people used to do, 100, 200 years ago or before that?
Well, I think it's kind of hard to put the petals back in the bud. So, so that I'm going to mix metaphors. That ship has sailed. And I'm not big on paternalism because I recognize from what we've been discussing, it's not necessary. What's necessary is you can be you can form tight rapport with your patients. You can listen with an ear that hears more than others. You can care with a heart that feels more than others. And that does not diminish your hypnotic influence, your curative capacity as a caregiver, as long as you're the one least uncertain about your commitment to that patient's well-being. So I don't think it's necessary at all. I don't hark back to it myself at all. I would say, however, that while that's been played, in my view, properly, and the time for paternalism is long gone, the notion of shared decision making is silly. I mean, it should always be offered, yes. And when you have someone who's really deeply engaged and uh, studied up, or will listen, or they want to share in the decision making, of course you should honor that. It's obvious. I think that was always part of medicine, personally. Um, but we should all remember that, we have a certain expertise, a certain knowledge base. I mean, you and I have probably between us read over 1,000 papers on COVID, right? So when are we going to sit down with someone and say, now let's make this decision together, and really expect that they're not going to say, Doc, I'm here to defer to you. I think
Of
we
course.
should we should offer it always, but respect the waiver,
Yeah.
right? So what drives our hypnotic influence, whether, as you mentioned, whether we're giving informed consent, risks and benefits, or whether we're simply discussing possibilities or treatment plans or whatever, what drives our ability to, if you think about it, to actually ignite their intrinsic healing capacity, to actualize the implied placebo suggestion, is that we're the ones least uncertain in that dyad between us and patient. And we don't have to, I don't care if I'm happy to be called Steve or Dr. Steve. I don't need, Dr. Bierman to have authority.
Mm,
I either evince it through my knowledge and my intention, or I don't. And then they'll go to someone else.
right. So to wrap up, I do want to touch on your new book. And I guess, what was your reason for writing the new book? Tell us about the new book. Maybe give us a super short preview, because I know we've gone pretty long already. But I'm really excited to read it. I haven't had a chance to read it yet, but the reason I am is because I think it applies to a lot of people, a lot of my patients, and even people in my family, very, very close family members in my nuclear family. And there's something, I guess one question to start off, like, why do you think there's something about our society that makes people worry so much, versus, if you go and check out a hunter-gatherer society in the Amazon, there's not that much worry. So I guess, what was the driving force to write it, and what do you think the kind of the diagnosis is for people in our culture, and how do they fix it?
Okay. Um, well, hearing that you have intimates in your family, uh, I, I'll I'll give a little more particulars on it. If you don't mind, I'll show the book just so people get it. It's
Great.
called The End of Worry. And what I learned was that, as I say, I see patients almost every day. And so I'm of course addressing underlying noetic causes, which we've discussed, but I noticed that people have habits, and habits tend to self-perpetuate, self-propagate. And often worry is a habit. You may not know it, but you've been taught it. Your family culture may have taught you that. Your mother or father, through modeling, may have taught you that. Um, it's not, as you mentioned, there are vast societies out there who that don't worry. And I was in one on an island not that long ago, explaining what worry was to a bunch of guys who were smoking their unfiltered cigarettes at the end of the day, and they all fell over laughing and said to me, "That's crazy. Nobody does that. Why would anyone do that? You're making this up." The Chinese have this old adage: "Worry is a misuse of the imagination," and that's really my favorite of those proverbs because it implies there's a proper use of the imagination, and you ain't doing it. And so over a period of 4.5 years, I devised using neuroplasticity and neurolinguistic programming and Pavlovian conditioning and other things. I devised a four-step protocol. It's a habit extinction. It's really a protracted extinction trial, a la Pavlov, and with other things layered in. And what I found was that, and I should tell everyone, you're not cured if you read the book, you're cured if you do the book. And cured means you will be cured of the worry habit. I mean, that will vanish. And so I started doing that for my patients and seeing remarkable results. And I was shocked. I knew it would work based on principle, but what I didn't think about, Syed, was what happens when, you have some people who worry 10, 20 times a day, night and day. They have all these negative imaginings. And that takes an awful lot of energy. Don't forget, our brain uses more glucose than anything. And
Mm,
what happens when you hard stop that habit? Where does that energy go?
mm,
And I started seeing amazing, amazing things. Psychospiritual development, like we were talking about before, on a impressive scale. Creativity blossoming into writer, artist, painter, artist, musical artist, ceramicist. I still do. I see all this stuff. It's really, really an unexpected, yeah, deeply, deeply gratifying thing for a tiny, what the book's like, what, 50 pages, 60 pages. And so I was talking to a guy who's written, a buddy of mine, he's written like 30 books. And I taught him the worry protocol. And he said, "Well, Steve, that's a book." And I go, "No, it's not a book. It's 50, 60 pages." And he said, this is a quote, he goes, "Wake up, dude, 50 or 60 pages. That's the American attention span." And I thought, I don't know how true that is, but I'll write the book.
mhm.
And so it's been really gratifying. I put on Twitter last night, I think. I got you know how it is. Somebody you don't even know writes in, and I got a letter from a lady in Germany saying, my whole life, I've been beset with nightmares every night of my life, and I'm doing the worry protocols, and my nightmares have finally ceased. And I wouldn't
Wow.
have anticipated that. And I can't say, that's all I know. I can't tell you why. But I'm getting, a lot of surprise feedback, and so far it's all positive. I'd be eager to hear how your family does, but Syed, the trick is you have to build a response potential. You have to tease them. Well, I'll give you this book, but you're not going to do it, so never mind. Tease it. Oh, I promise I'll do it. Nah, how do I know you'll keep your promise? And once you've really sunk the hook, give them the book.
Okay. Yeah, that's important. Very, very important with somebody
Yeah,
like your wife or, one
yeah,
of your parents,
yeah.
Yeah. So that's fantastic. Do you only do in person or do you do telemedicine also?
Yeah, I don't, I would say as a general rule, I don't do telemedicine. There are two reasons. One is, and again, it goes back to watch YouTube, The Most Amazing Experiment in Human Psychology. There's enormous amounts of nonverbal information that flow between me
Mm,
and my patient in the office, and I use that.
yeah.
But the other thing is just I've had some experiences where I had, say, for example, someone in deep trance, pre-surgical, and then I lost connection, and they're out there in Florida, and I don't have regular access to them,
Um,
right? So we
I
may
see.
do, and actually that worked out uh, okay, but I really don't want to find myself in that situation.
So where can people seek you out? And then if they can't seek you out, is there a good list of people who do something similar to what you do?
Well, so my practice is I'm
Both.
overwhelmed.
Okay, okay. Maybe you don't want more.
Very much. You're a great guy, but uh, I think there are some great starting points. Many people who have read the book Healing, if they have enough insight and introspection, they can draw a huge benefit from that. And I've had nice feedback in that regard. As I said, and I'm really excited about this, I think it's key, is um, the Andrew Weil Center for Integrative Medicine recognizes that the grout that holds together all the mosaics of integrative medicine is what I'm talking about. Because everyone needs to know how to present ideas properly and how to deal with the ideas, conscious and unconscious, of their patients. That's noetic medicine. And so we're forming the Noetic Medicine Institute this year. And online, there will be classes, there will be a referral directory, there will be teaching and training and public outreach, all of that. And so it's
That's
coming
wonderful.
soon. I wish it were available now. I'm sorry it's not, but we're on it.
Great. Yeah, I look forward to that. So when you said that, if people have enough introspection, are you saying that patients themselves could operationalize the healing book or practitioners or both?
Oh, well, first for the worry book, yeah, of course, patients can if they do it. And just gear yourself up and know you're going to have to run the protocol a couple hundred times to get the effect. And that total of 10 hours over 2 or 3 months, and you're cured. The healing book, what especially the last third, it talks about noetic causes, guilt, baleful wishes, etc. And it requires what Bertrand Russell called brutal honesty, right? But if someone can be brutally honest with themselves, and I'm often surprised how capable people are of that. Ask yourself why today and guess. Don't try to reason it or think it. Just guess. What is a guess but a whisper from your unconscious? And then deal with whatever comes up. You can help yourself along the way greatly by attending to these major causes. And then, as I say, it's a good thing for everyone to hear a second time and underscore is never, ever, ever give in to, I need to get out of this no matter what. Don't engage no matter what wishes. Ask for a healthy solution, only healthy solutions.
All right, great. I had a question, but there was this music in the background. I might have forgotten it. What was I thinking? I was going to ask you something about this topic of the operationalizing it. Maybe it'll come back to me, but we don't have much time here yet or left. Anything that I didn't cover that you wanted to really get off your chest?
I have to say, I think your questions, they're just excellent and pertinent, and I hope people um, benefit from our discussion. Um, I think the thing I would want to leave people with is, we as humans, we're really, really amazingly complex creatures. And our I have no desire to throw our science out. I think it's stupendous, but it's also incomplete. And if we begin to surround our sort of physical science with the broader awareness of noetic causes, then I think we all stand a greater likelihood of benefiting from improved health and happiness and psychospiritual development. And so that's pretty much where I would leave it.
Right. I never let anyone leave it at the end. So I do remember the question that I had. So I'm going to go back and, that was a great wrap up. But I have to ask, just like from the perspective, I actually, I see patients and I think about these things that I've read from your book. So, you know, why today, right? That's a great question, especially in an ER when people come in on the day, right? With me, I'm not in the ER. Patients come to me and a year later after the thing happened, right? So they're kind of reaching back into their mind, trying to figure it out. So does it really just require just waiting and not saying anything until they pull it back up? Or, is there anything special, any special trick to helping them access something that happened, maybe in some illnesses could have been years ago, right? Not just a year. It could have been a really long time ago when
There
it
is
started.
there is a trick. Again, I just got to, doff my hat because that's a great question. There is a trick, and the underpinning of that trick is realizing that, yeah, there was a sequence of causal events or triggers, of course, but they still have it,
Mm.
right? And so something is still going on. So the way I do that with patients is I say, um, let's do a thought experiment. And let's assume this may or may not be true, that this thing you're suffering from, this could have been gone a year ago. Let's just make that assumption for the sake of this experiment. Or it could be gone 2 weeks from now, or 2 days from now, or tonight. And I always back that into the present because now I've set the bounds, right? Um, you still have it. You're not going to know why, and I'm not. Let's not pretend to know why. But if you had to guess, why now? Why still? And they'll say, well, you're the doc. Yeah, I'm the doc. But like I said, I don't know. You don't know. Just guess. Just means and nothing else. Just guess. And then, you zip it and you wait, and the answer will come. And I guarantee you, Syed, say it that way, sort of, it's casual. It's not a big deal. We're guessing. Let's not make too much of it. That lowers resistance, right? Even once I have it, I say, well, it's just a guess. So let's not take it too seriously, but let's go with that. What about your mother-in-law moving in? How do you feel about that? What is that? Well, I want out of the house. I don't want to be there. Well, you're out of the house. You're in the ICU, dude. And you might have made a healthier choice. Let's talk about healthy choices, right?
Mm.
So the trick is the um, thought experiment presumption that it could have been gone a year ago or 2 weeks from now or 2 days or tonight. Why now? Why still?
And when you said you're setting, I forget the phrase you used, but kind of setting the boundaries there, are you choosing like the 2 weeks? It's kind of like a suggestion that, hey, it may not even last more than 2 weeks. I mean, it could be gone the next 2 weeks or even tonight. Is that what are you trying to get at that with that phrasing for them? Like instead of saying it could be gone 10 years from now, for example.
I'm always mindful of my hypnotic influence. And I understand that that has nothing to do with trance. It has to do with the dynamics of our relationship. They feel relatively helpless and dependent. They've identified me as the one least uncertain. I have hypnotic influence. And so I'm going to use that, but I'm only going to use it to achieve what their goal is. And their goal, I assume in this instance, is getting better fast. So, yeah, I don't want to put anything out there 10 years. It's a thought experiment. But the
Yeah.
thought experiment is allowing me to subtly implant the suggestion that it could go away in 2 weeks or 2 days or tonight.
Have you ever, this is probably the last question. Have you ever come across a situation where it wasn't helpful for the person to get rid of for you to help them get rid of the thing that they had so easily?
Well, again, one of the questions I've learned to ask is I always do what's called a congruency check whenever I have a new patient, because we make the assumption they want to get well. And when I say that, meaning that they want to get well without ambivalence. They don't have competing ideas. That's our assumption, but that's not the human condition. You know, ambivalence is the human condition. And so I'm treating, for example, a beautiful young lady. She's 18 years old now with an eating self-harming disorder. And I asked her that question. Let's call her, I call everyone George or Mary, so let's call her Mary. Said, Mary, I just have one more question for today. I'm curious, it may seem a little silly. There I'm dropping resistance. Are you sure, really sure that you really want to get well now? And this is how she reacts. She goes, well, well, now, later, and then she just stopped. And I said, well, if it's later, how much later? And she said this to me, and I thought it was darling. She's a darling young lady. But I also thought it revealed a sort of self-knowledge that she had about the internal adjustments within the personality that needed to be made. She said, well, could it go away gradually over the next year? And I said, yes. And if at some point in that year you discover that you want to accelerate that, then we can work on that too. So there, people often have a sense, you know, some people come for hypnotherapy for silver bullet magic cure, and I, you know, it happens, but not always. And I tell people that, you know, but other people have a deep intuition that I respect, that they need a couple months or a couple weeks, or because, you know, as she changed the way she relates to herself, which is what knowing her causes, what this will entail. She also changes the way she reacts to her friends, her mother, her father, her boyfriend, her, you know, every sort of interaction she engages in will have to refract through a different personality. And so she's saying, I'm going to need time to make this because it's a massive adjustment. And so I respect that. And every time I'm with a patient, Syed, I reaffirm the goal because it shifts and moves and modulates. I just say, what's our goal today? Your goal is my goal. And then we move forward.
Amazing. There was so much stuff we didn't have time to cover. I highly recommend people get all your books. If you ever write a new book, I'll be buying it. So, is there any place, I know you have a Twitter, which I was so pleased to find out because I think you actually reached out to me on Twitter. I didn't even look for you on Twitter. So I think that you're criminally underfollowed on Twitter. So what's your Twitter handle?
Steve Bierman, MD.
Okay, great. And is there any other place that you have a website, I think? Any other place people should seek you
Well,
out?
I have a website. It's healingbeyondpills.com.
Okay.
And I have a YouTube channel, just right. YouTube, Steve Bierman, author of Healing, and it'll pop up. And the YouTube channel, I think people will find, you know, interesting. The experiment I reference is there. One day of my introductory class is there. Some old stuff when I was a young man with dark hair, working in the emergency room is there. I think it gives people a sort of, you can gather in a sense of what is noetic medicine? How does it work in the day-to-day? How does it work in the deep? and they might enjoy that.
Do you do lectures or public, sessions with people or trainings anymore? Or
I
is that
do.
all for the Noetic Medicine Institute?
I teach all around the world, so I've taught this year in Australia, Canada, US, of course, and Europe. Each year I teach introductory and advanced classes in Europe. If people reach out to me through the website, I'll connect them with course sponsors. And if they want to really, really learn noetic medicine now, the way to do it is to get in that 3 to 6 day course. In the future, I would say within a year or two, the same course will be offered at the Andrew Weil Center.
Okay. And have you thought of or looked into, like I said earlier, starting some sort of coursework for, medical doctors in school, before they actually graduate? Have you discussed this with any medical schools, or is that anything that we can hope to see on the horizon for medical professionals to start learning before they leave school? Because I really think that you need a lot of practice with it, right, to get really good at it. And it seems like it should be, a required course every year, until you get the hang of it.
Well, again, I have to applaud you for getting it, and we shouldn't think that uh, the dean of a medical school would get it. And so that's it's going to happen, I believe, but it's slow to come. So here's what's happening in that regard. Um, in March of this year, I'm delivering what will be I think we'll put this online through the center. It'll be the first lecture of the first day in medical school. What every medical student should hear day one, hour one, minute
Mm.
one. And it's basically a plea to retain the human qualities as you go through your medical studies and recognize the impact of ideas on health and healing. Um, the I will be working with the departments both of medicine, which is interesting, and family medicine. And so there will be noetic medicine courses at University of Arizona College of Medicine. And we do
Awesome.
plan, as those become more formalized and modular, we do plan to export those to various medical schools as the influence fans out.
Amazing. Thank you so much for your time. And it was
Yeah,
really a
and
pleasure. The
I
great
really
interview.
appreciate the way you've really dedicated yourself to understanding this and thinking of the various implications and how-tos and whys. And I'm very grateful to you. It was a great series of questions.
Great. I'll share the interview once it's live. I'll put it up and send you a link. Okay.
Yeah,
Thank you
super,
so much.
super.
All
All the
right.
best.
All right. Thanks. Bye-bye.